Hi, this is Mark Rabin. Welcome to episode 228 of Lean Blog Audio. This is a post from September 11th, 2017 titled, Toyota Helps Children's Health Dallas Reduce Some CLABSI Infections 75%. First, on a personal note, some of you have reached out to express concern about me being in Orlando during Hurricane Irma. My wife and I both go back and forth between Orlando and Fort Worth because of her job, and thankfully we have both been in Texas during all of this. So I appreciate your concern. If you can, please consider donating to the Red Cross or other organizations that will help with hurricane relief in Florida, and not to forget Texas. Unlike with Hurricane Harvey, which didn't affect Fort Worth at all, we have fingers crossed that our Orlando home wasn't damaged, and more importantly, that there isn't any loss of life in Florida. So now here's today's post. I've long been appreciative of the work that Toyota does through their nonprofit TSSC subsidiary to help nonprofits and community organizations improve. The latest example of that is some work done at Children's Health in my other backyard here in Dallas in a release titled Children's Health Joins Forces with Toyota to Improve Patient Safety and Quality of Care. You can find a link to this article if you go to leanblog.org/audio228. As it says in the release, through a collaboration with Toyota, Children's Health, the leading pediatric health system in North Texas, announced today it has successfully reduced rates of central line associated bloodstream infections, or CLABSIs, by 75% with patients in the gastroenterology unit. So this is really important work, and these are fantastic results. Dr. Rick Shannon used Lean and Toyota methods to similarly reduce CLABSI rates at multiple health systems, as we discussed in a podcast a few years back. You can find that at leanblog.org/127. Back to the improvement work at Children's. It says, the teams work together to identify unintended process breakdowns. Through TSSC's process methodology and expertise, Children's Health determined the immediate environment of care is vital in the process of maintaining cleanliness of the central line. So, as an outsider to this, I'm not surprised that they found unintended process breakdowns. Healthcare quality problems often aren't the result of people not knowing what to do. And these problems are certainly not the result of people not caring or being so-called bad apples. What gets in the way of people doing the right work, the right way, at the right time? It could be supply chain issues. It could be general conditions of overwork caused by there being too much waste in their daily work. As we typically see in reports of Toyota's work with nonprofits and suppliers, Toyota doesn't come in to tell people how to do their work. They have an improvement process that they teach that allows those doing the work and their leaders to discover problems and to work together on systemic improvement. Again, from the article. Children's Health invited us into their units to see the clinical processes firsthand, and together we were able to implement a program that we hope can be a model process, said Jamie Benini, Vice President of TSSC. Quote, by leveraging the methods of the Toyota production system like problem solving, standardization, and rigorous training, we are pleased to help make life better for children in our new home in Texas. Toyota, of course, recently opened up their new North American headquarters in nearby Plano. So we've previously seen Toyota's collaborative approach and their work with UCLA Harbor Medical Center. I've blogged about this before, and there's a couple of videos posted. You can find links to these again at leanblog.org/audio228. And TSSC has done similar work with a food bank and other efforts to provide relief after Hurricane Sandy, as I wrote about in 2013. But back to the children's story. It says, by the end of 2017, Children's Health will roll out improved practices from the collaboration system-wide, ultimately empowering team members to implement improved care processes to prevent infections across multiple hospital units. So I'm curious to see how that rollout will be managed. In some organizations, an internal rollout of best practices isn't always well received. ThedaCare, for example, has had an effective process, though, where an alpha unit, as they call it, the first unit to create a new method shares it with another unit that they call the beta. The beta unit can choose to adopt or adapt the alpha method and has an obligation to try to improve the alpha method so that learning and improvement can be shared back with that alpha unit and other groups going forward. That takes longer than a simple organizational copy and paste approach, but it's more effective. I hope TSSC and Children's are using a method like ThetaCares that spreads practices and empowers team members along the way. It says again in the article, additionally, Children's Health plans to share its findings with other healthcare systems around the country in hopes of reducing preventable harm to children everywhere. Now, I hope that other hospitals are willing to adopt not just the new practices for managing central lines, but are also willing to adopt the improvement methods advocated by Toyota and TSSC. As another release that I've linked to says, Toyota has been helping organizations for 25 years now. Again, I thank them for this work and for giving back to our local Dallas-Fort Worth community and beyond. As a final note, I've previously had the opportunity to do some lean consulting work with Children's back when I worked for a group called Volumetric Services when it was a part of Johnson & Johnson. I coached improvement teams in the laboratory and radiology. Some of that lab improvement work was written up in an article that I co-authored with their lab director, and I've linked to it in the blog post. Since Children's isn't too far away, I've been able to continue making some pro bono follow-up visits in recent years to provide some ongoing coaching. It's great to see that the lab and radiology have sustained the work we did together, sustaining the methods and the results, and more importantly, they've continued to improve. So I want to thank you for listening. If you like the podcast episode, you can subscribe through iTunes or other places you find podcasts. If you are a subscriber, I would ask you to please rate and review the podcast. That's really helpful in terms of helping others find what I'm publishing here. So again, thanks for listening.